Lipschitz, board certified plastic surgeon at Athena Plastic Surgery. So what's the difference between a mini facelift and a full facelift? Let's talk about incisions and dissection and what we do and why we do it on different people. This is a great example of a patient that needs a mini facelift. She's got minimal jowling. She almost has no neck problems. She has some eyelid issues, early signs of facial aging. She's only in her 40s. Sometimes patients in their 50s and even 60s only need a mini facelift. So here she is post-op. Now what have we done? There's a small incision in front of the ear. There's no incision typically behind the ear. There's also no incision under the chin, which we normally do in a full facelift. And you can see a beautiful new jawline, but it has less dissection, and at least the implication is that there'll be a faster recovery with less scarring. Here we have her pre-op with a little bit of jowling, a little bit of descent, not much going on in the neck, but signs of early facial aging. Post-op with her short scar incision, nothing behind the ear, nothing under the chin, and she's obviously been improved with a nice new jawline, good volumization, and her neck is also improved, but she's only had a minimal access or mini facelift where there's less dissection. Here's a great example of a patient who needs a full facelift. She has upper eyelid skin excess, lower eyelid kind of wrinkles, a lot of soft tissue descent and neck laxity with jowling. So here she is post-op. She's at about 6 weeks here. She had an upper and lower lid blepharoplasty and a deep plane facelift and a deep neck lift, removing all the deep soft tissue under the chin, contoured the cheek and the neck. And let's take a look at her from the side view. You can see jowling, significant descent of the soft tissue and the skin, and a lot of volume under the chin. I don't think you could get away with a mini facelift in this kind of case. Result of a deep plane face and neck lift and an upper and lower lid blepharoplasty. The incisions are around the ears, there's one under the chin. Deep soft tissue is contoured and skin is redraped. Significant amount of deep soft tissue descent and skin laxity. And here she is obviously contoured with a nice neck contour and elevation of the face. Incisions in this case are around the ear, back into the hairline. There's a small incision under the chin. The recovery is potentially a little bit longer. This is an example of bespoke facelifts. This is the difference between a mini facelift and a full facelift.
Most patients, to be honest, need a full facelift. Mini facelifts are really reserved for people with minimal descent, minimal soft tissue volume loss, and they only need a very small amount of elevation. Now, both incisions, whether it's a mini facelift or a full facelift, should be very well hidden regardless. And here's one thing I've learned over the years. Don't cheat yourself. If you need to do a full facelift, just do it. Trying to do a mini facelift and avoid the neck is kind of under-treating people, and it's the right thing to do always to connect what's wrong with the patient with the right operation.